Illness is spreading across the country and here in East Texas, COVID-19. And while cases are rising, the risk of hospitalization and death from the virus is down significantly from the start of the pandemic, with an estimated 97% of Americans having some type of immunity.
So we've seen a little bit of an increase over the last few weeks.
NetHealth's George Roberts is talking about the spread of COVID-19. The latest map of community spread levels shows the virus is spreading at moderate levels in Smith, Gregg, Wood, Van Zant, and Henderson counties, a change from this map 2 weeks ago, when all of the counties in NetHealth's jurisdiction were seeing minimal spread. And Roberts says the information used to determine spread does not include at-home testing.
The home testing people do, we don't hear about. But anecdotally, we've heard of a number more cases coming up than there were, say, back in June.
And while more East Texans are catching the virus, a majority of those cases are mild. And while increasing, the number of people hospitalized with the virus remains relatively low.
The hospital numbers went up. We had 24 in East Texans in the Tyler hospitals. Last Thursday, yesterday it was 38. So we're seeing a little bit more in the hospitalization range. But more cases, but they do not seem to be as severe as they were in previous times.
Looking at historical data, Roberts says this late summer increase follows a trend seen in previous years.
What happens, it goes back down in September and October, and then maybe we saw in 2020 around Halloween it started kicking back up again. Well, last year it seemed like it was around the Thanksgiving area before Christmas. So it's sometime late fall or early to mid-fall is kind of when it starts picking back up again.
An updated COVID vaccine is expected to be released next month, and shots for the flu and RSV are already available.